Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa. I'm a registered nurse and this is the Lucky Nurse Lectures. So in today's lecture video, we're going to be covering dosage calculation problems using IV flow rate. So in this video, I do have a couple of sample problems so that we can go over how to actually apply the equation. But before we get started, I do want to put in a very quick disclaimer just to say that although I am a licensed registered nurse, I am not a trained instructor. So if you have any questions in this video, please feel free to comment down below. I will do my best to answer them. But if you have very specific questions, I would always advise you to talk to your college instructor, your professor, or refer to your textbooks. So with that being said, we're going to go ahead and get started with today's video. Okay, so what is an IV flow rate and how do we know when to calculate it? So when administering intravenous or IV medications to a patient, that medication is always going to be in liquid form. Even if you have a medication that comes as a solid or as like a powder, we're always going to add a liquid to it, whether that's normal saline or some other liquid, in order to make a liquid solution. And so in the end, liquid is actually what is going to be infused, liquid medication is what's going to be infused into the patient's veins and enter the patient. And so the IV flow rate is going to be the rate at which the IV delivers medication to the patient. Typically, this unit of measurement is going to be in milliliters. Sometimes it can be in drops. So if you've ever seen drops per minute or GTTS per minute, that stands for drops per minute. So it's going to be in one of those two units. In this video, we're going to be working with milliliters and milliliters per hour. In my next dosage calculation video, I will be doing drops per minute. So if you're interested in that, that is coming. So just for reference, some medications will infuse into a patient over 30 minutes, which is considered to be quick, while other medications can be continuously infusing into a patient over a longer period of time. So like 4 to 8 to 12 hours. And so when will you need this information? When I was in nursing school, I used to think that I would never need this information because we have IV pumps that do all of these calculations for us. Now that I've been a nurse for 2 months already, not very long, but I can tell you that there have already been a couple of times where I've had to do a couple of my own calculations, or there have also been a couple of times where it's kind of saved my butt, where I'll type in all of the numbers in a patient's order into the IV pump, and at the end of it, it'll give me an IV rate that just quite doesn't look right. So I kind of do mental math in my head, and it turns out that something was wrong, and so I'm able to troubleshoot it and fix it. Versus if I had no idea how to do this math, I wouldn't know that the numbers looked off in the first place, and the patients would have gotten the wrong medication infused. So it's always good to know this information. And with that being said, we're going to go ahead and go over the formula. So this is the formula to determine the IV flow rate, and it's very simple. It is total volume over the infusion time is going to equal the IV flow rate. So typically the total volume, at least in this, is going to be in milliliters. So our answers for this video are going to all be in milliliters per hour. So we're going to go ahead and get started with our first sample problem. So you can pause the video here if you would like to, or you can read along with me. The patient has an order for 1,000 milliliters of normal saline to be infused over 4 hours. Normal saline is available in a 1,000 milliliter IV solution bag. In order for the patient to receive 1,000 milliliters of normal saline over 4 hours, what should the IV flow rate be? So the very first thing before I even really pick apart this sample problem is that I'm going to go ahead and just write out the equation on the screen just for a mental reference for myself. So now that the equation is on the screen, and again, the equation is going to be total volume over infusion time equals flow rate. The next thing that we can do is we can look at our sample problem and start plugging in numbers and units from the problem into our equation. So milliliters is the only unit of measurement that is a volume in this equation. So we can go ahead and plug it into our numerator. So it's very simple. So the next thing we're going to look for is infusion time. Remember I said all of our answers are going to be in milliliters per hour. Well, In our numerator, we now already have the milliliter unit. So now we're looking for hours. And luckily in this equation, we are just given how long the medication should be infused for in the final unit that we need, which is hours. So the medication is to be infused over 4 hours. We can go ahead and plug 4 hours into our denominator. So basically, we're all done plugging in our units. This is a very simple equation. So the last thing that we're going to do is we're going to divide our numerator by our denominator. So 1,000 divided by 4, and that's going to give us an answer of 250. So in order for the patient to receive 1,000 milliliters of normal saline over 4 hours, the IV flow rate should be 250 milliliters per hour. Do not be like me. I forgot to write the unit of measurement at the end. I just wrote 250, but the answer is 250 milliliters per hour. And so now this is the next sample problem. It is a bit trickier. You can pause the video here to read it yourself, or you can read along with me. The sample problem reads, the patient has an order for thiamine 100 milligrams to be infused over 30 minutes. 100 milligrams of thiamine is available in a 500 milliliter IV solution bag. In order for the patient to receive 100 milligrams of thiamine in 30 minutes, what should the IV flow rate be? So just like the last equation, the first thing that I always like to do is write out my equation on the screen just for a mental reference. And of course, it's that same total volume over infusion time equals the flow rate, which is what we're solving for. So now that the equation is on the screen, I want to scan over the sample problem and look for information so I can start plugging it in the appropriate spots of my equation down at the bottom. So there are multiple numbers and multiple units of measurement in this problem, and we do not need all of them. So what we're going to do now is we're going to figure out what information is important in this problem and what information can kind of be canceled out because we don't really need it that much. So if you look at the sample problem, in the first line, it tells us that our patient's order is for 100 milligrams of thiamine. Next, in the second sentence, it tells us that 100 milligrams of thiamine is available in a 500 milliliter bag. So these two things are the same. 100 milligrams of thiamine comes in a 500 milliliter bag. 500 milliliter bag, one 500 milliliter bag of thiamine contains 100 milligrams of thiamine. So they're one and the same. We don't need both. And for this equation, what we're looking to plug into our numerator right now is going to be something with a unit of measurement in volume. So we can go ahead and cancel out the 100 milligrams of thiamine. All that we need is that 500 milliliters of thiamine in our IV solution bag. And since the 500 milliliters of thiamine is the only volume-based solution in the entire problem, we know that this is what needs to go into our numerator, so we can go ahead and plug it into our equation at the bottom. Now, the next thing to look for is the infusion time. So we know the only unit of measurement that involves time is that 30 minutes. So the patient's medication needs to be infused over 30 minutes. So we can go ahead and plug 30 minutes into our denominator, and we could leave the equation like this and it would technically be correct. But like I mentioned before, we are looking for an answer in milliliters per hour. So to be extra correct, and what would actually have to be plugged into an IV pump would need to be the amount of time in hours. So we're going to use dimensional analysis to convert 30 minutes into how many hours that would be. If you have not seen my lecture video on dimensional analysis, you can go to my channel and take a look at that. So we can go ahead and plug 30 into our equation. And now we could just leave the equation like this and it technically would be correct. The patient needs to receive 500 milliliters of thiamine over 30 minutes. That's correct. But like I mentioned before, we're looking for an answer in milliliters per hour. So the next thing that we're going to do is we're going to convert 30 minutes into hours. And then our milliliters also needs to be adjusted as well. So in order to convert milliliters to hours, we're going to use dimensional analysis. If you're unfamiliar with dimensional analysis, I do have a video detailing this method on my channel, so you can go and check that out. But here I have my chart set up in order to do my conversions. Now, in order to convert minutes into hours, we need to enter 1 hour into this chart. So 1 hour has 60 minutes in it. 60 minutes is equating to 1 hour. So we went ahead and put that into the chart. I went ahead and put 60 minutes into my numerator so that it would cancel out my 30 minutes in the denominator. Since they're both the same unit of measurement, they cancel each other out. So now we're left with our final units, which is milliliters in the numerator and hour in the denominator, and that is exactly what we're looking for. So we can do our final step to solve. And the way that we would solve is we would multiply everything in the numerator by each other, everything in the denominator by each other, and then we'd go ahead and we would divide our numerator by our denominator. So 500 times 60 is going to give us 30,000. That unit of milliliters transfers over. And then we have in the denominator 30 times 1, of course, equals 30. And then that unit of hour was never canceled out, so that transfers over. So we're left with 30,000 milliliters over 30 hours. We're going to go ahead and divide 30,000 by 30, and we're left with 1,000. So our final answer is going to be 1,000. In order for the patient to receive 100 milligrams of thiamine in 30 minutes, the IV flow rate should be 1,000 milliliters per hour. So that is it for this video. If you like this video, please give it a thumbs up. Hopefully it was not too tricky. If it was, and if you have any questions, please feel free to comment down below and I'll be happy to answer. Thank you guys again for watching this video, and I will see you in my next one.